Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate how to put on and take off an N95 respirator. Before donning or putting on an N95 respirator, you always want to follow the manufacturer's instructions. Also, you want to follow your facility's protocol for getting fitted for your N95 respirator. And this is usually done yearly, but it can vary. First, what you want to do is you want to perform hand hygiene. Hold the respirator in one hand with the front of the respirator touching the inside of your hand. The metal nose piece should rest near the fingertips. Be sure the top and bottom straps of the respirator are hanging down below your hand and are not tangled or twisted. Take the respirator and place it over your nose, mouth, and under the chin. Hold the respirator in place with one hand. Use your free hand to place the straps on your head. It's very important the straps rest on the head and that they are not overlapping or tangled. First, take the top strap of the respirator and place it just past the top of your head, above the ears. Then take the bottom strap of the respirator and place it around the bottom of the head, just below the ears. Again, make sure the straps are not crossing or are overly twisted. To ensure a proper seal of the respirator around the nose area, use the fingertips of both hands to bend the metal nose piece around the nose, starting in the center and working your way outward on each side. Now perform the seal test. This is performed to check if you have donned the respirator correctly and that it does not leak air. Always follow the manufacturer's guidelines for this part because it can vary between brands. First, place both hands over the respirator. Then take a sharp breath in and make sure the respirator is sealing over the face during inhalation. Keep both hands on the respirator, breathe out. While breathing out, make sure you feel for air leakage around the nose piece and around the respirator's perimeter. If leaking air around the nose piece, try rebending the nose piece with both hands and recheck the seal. If air is leaking around the respirator's perimeter, try readjusting the straps and recheck again. Make sure the respirator is not being affected by any piercings, facial hair, or glasses, which could prevent a proper seal. If respirator still leaks after this, you may need a different size or type of respirator before use. Now to doff or take off the mask. Two things you want to remember is that you don't want to touch the front of the mask because it's considered contaminated, but you can touch the straps of the mask because these are considered clean. First, you will take your hands and you will remove the bottom strap by pulling it over the head. Then you will take the top strap and pull it over the head. Be very careful not to touch the mask. Now you can dispose or reuse the mask depending on your facility's protocol and then perform hand hygiene. Okay, so that wraps up this video on how to don and doff an N95 respirator. And be sure to check out the other videos in this series.